Now, so how about from the point of view of the public, right? Let's say, for example, if they want to go to either private or public sector for specialist care, obviously, I guess in the public sector, there's different ward classes.
Correct.
And how about in the private sector? Do they get to choose what class or ward do they have?
I think in general the ward class is the same.
Yes.
Unless you really want to go a premier kind of lounge like the presidential suite.
Right.
Those ones will cost just like your Marina Bay Sands presidential suite, right? Probably $10,000 a night or something like that. So but in general, I think the charges for the private hospital rooms are pretty much the same. Either you are single bedded or 4 bedded rooms.
Right. Then would there be a difference in quality of care between the president's suite versus the...
Well, I guess those are for VVIPs. So yes, the cares will be. I mean, you get the same nursing staff, but you probably a bit more attention to detail. But I think the changes are subtle in
right.
But I know that in public hospitals you can have A class,
Yes.
B1,
Yes.
B2, and C class.
Right.
So my understanding is that in a restructured hospital or public hospital, when you have class A and B,
Yes.
your room is nicer, and you don't have share bathrooms.
Right.
So for example, your class A will have a single bed to 1 toilet.
Right.
Class B1 will be maybe 2 beds to 1 toilet.
Yes.
And B2 is gonna be 4 beds or something like that.
Right. Yeah. Just for our curiosity also, I want to ask Kenneth, how do you decide, or how do you help your patient decide where to go for specialist care, whether it's private, whether it's public, and if it's public, which hospital, why, what are some factors?
Oh wow.
And whether, private in the public hospital or public, subsidized care.
Well, I think when a person is looking for healthcare, generally I look at the patient and I see what matters to them.
Yes.
Yeah. So a lot of the times they are looking for a doctor that they can trust. And so I would prefer to refer them to specialists I've worked with before, who have reasonable charges, who have high quality, medical care, attention to detail, and do not overcharge. So then I would recommend, specialists that maybe I've met at our GP Plus cooperative meetings, or my classmates whom I've known for many years, and I know that they are doing good work. So that would be my top recommendation. But of course, a lot of patients they are concerned about healthcare costs, or they have already purchased some form of insurance that will be restricting the kind of specialists that are accessible to them. Yeah. So for those who are looking for private specialists under their panel, then generally I will take a look through their panel and guide them in a certain way. But some of my patients feel like they would want to make their own decisions. I think it's nothing wrong to make your own decisions, but you are missing out on a very important resource, which is our experience. Many years in primary care and seeing patients with the same health conditions. You're missing that experience that we have helping other patients with the same problems. And then lastly, when you talk about public healthcare, generally you have two options again. You can actually go after a named consultant, and I do recommend if you can swing it, to go for a named consultant, because that will determine who is the one who's giving you the medical advice. If you can't, then it will be the general queue, right? And that will mean that your specialist or your consultant will be randomly assigned depending on who is on the roster for that particular clinic session. Yeah, so those are all the different levels, and generally we try to guide our patients through the process.
Yeah.
Sometimes in the subsidized route, you may or may not get a specialist. You may get trainees as well.
Yeah,
like
exactly.
So there's a bit of a hit and miss.
Yeah.
But certainly these registrars are all supervised by the specialists in the public hospital.
I wonder whether you can say this. You can cut this out. But for some of our GPs, right, who actually know the public specialists quite well, and we really see people who are in need, that need an urgent or earlier follow up with a specialist, then sometimes there can be some things that we can negotiate with the public specialists to see them a bit sooner.
Is that right?
Do you do that?
I have not done that before.
You've not done that. Huh? I do, for rheumatology, for example. Yeah, they don't have their DMARTs or their things. So I know the Sengkang RAI. Then I will actually message him to say, can you help me see?
Who's that?
Huh?
Who's that?
This Kushianto or something like that.
Oh, okay.
Yeah.
Okay, so having
Then
said that,
dermatology also. Like some of my friends who are now
yeah.
senior consultants, they will pick up the patient from the generalist.
okay, having said that, actually I don't think we need really to cut that. But seriously,
Controversial lah.
Controversial.
Yeah.
Because only people who've seen us for many years, and then we will say, actually we can help pull a bit of
Suddenly,
string.
suddenly every 5 calls from GPs and oh, please help me.
well, I mean, having said that, I know that in healthier SG, maybe called part 2 or part 3, so we are trying to actually make referral more seamless between public sector as well as the private GPs. So there's this thing called virtual professional consultation. So what it means is basically there's always interaction between the GPs and the specialists in the hospital based on the discipline. Yeah, so there's always a group chat, a general group chat that the GPs can post questions, the specialists can advise the GP and so on. So these are all not named basis, but there's also a version of it which is being tried out in the polyclinic. So that might be the one that you're talking about. Yeah, so they actually have done it for a couple of years. So what they can do is that they go into a more secured platform where they discuss the patient, and if need to, the specialist can actually arrange to see the patient earlier, because the queue for the general queue may be very long, but the specialist in the hospital may not want to miss out those urgent ones as well. Yeah, so that sometimes that happens. Yeah, but I think that one is mainly in the polyclinic at the moment, but in future it will be coming on to the healthy SG GPs as well. Yeah. So wait for that. Yeah.